Hello, I'm Dr. Pesavento. You have been diagnosed with a retinal condition. It is important to all of the doctors at Retina Consultants of Southern California that you understand the condition, as well as the risk and benefits of the treatment your doctor has recommended. This video you are about to watch explains this. Choosing any form of treatment or surgery can be a difficult decision to make. While some people may experience side effects from their medications or surgery, the risks of side effects should always be balanced with the greater risk of leaving your condition untreated, which may include loss of vision. Your doctor will be happy to discuss any questions you may have after you watch the video.
Age-related macular degeneration, or AMD, is the leading cause of vision loss in people over 65. If you are diagnosed with AMD, it is important to understand this condition and learn what you can do to help preserve your vision. First, to understand how AMD affects your vision, it's important to understand how the eye works. Light rays enter the eye through the cornea, pupil, and lens. These light rays are focused on the retina, the light-sensitive tissue lining the back of the eye. The retina has two areas, the peripheral retina, which gives us our side or wide-angle vision, and the macula, the small area at the center of the retina. The macula gives us our pinpoint vision, allowing us to see detail clearly. Age-related macular degeneration, or AMD, is a breakdown of the macula. When the macula doesn't work properly, your central vision can be affected by blurriness, dark areas, or distortion. We see this condition affecting many people as they age. There are two forms of AMD. One is the atrophic, or dry form. The other is the exudative, or wet form. About 90% of people who get AMD have the dry form. The retina is made up of many layers that are sandwiched together into a smooth surface. These layers work together, allowing us to see clearly. In people with dry AMD, the layer under the retina, known as the retinal pigment epithelium, or RPE, is affected by deposits called drusen, as well as other age-related changes. These changes may cause vision to get worse over time. Many people develop dry AMD as they age and don't realize it until it's found during an eye exam. In a number of cases, it is very mild and may not cause any symptoms. However, the disease can get progressively worse, which is when people may notice their vision deteriorating. Some people, usually those who have intermediate AMD in both eyes or advanced AMD in one eye, are at a higher risk for developing later stage or wet macular degeneration. Wet AMD is where abnormal blood vessels grow under the macula and leak fluid or blood, severely affecting vision. There is no treatment yet for the dry form of macular degeneration. However, the latest scientific studies show that taking certain dietary supplements may keep AMD from getting worse in those people with early or mid-stage disease. The supplements found to be helpful for dry AMD include very specific amounts of vitamin C, vitamin E, lutein, and zeaxanthin, along with the mineral zinc. Your ophthalmologist can tell you if you're at risk for developing advanced AMD and if supplements are recommended for you. At any stage of AMD, ophthalmologists urge their patients to closely monitor their vision every day for any signs of changes. A basic yet important tool for monitoring your vision is called an Amsler grid. You can use it at home to detect changes in your central field of vision. You simply cover one eye and look directly at the center point of the grid, but observe the vertical and horizontal lines in your side or peripheral vision. Then do the same with the other eye. Typically, vision problems due to AMD would cause some of the straight lines to appear wavy or blurry, or areas to appear dark or even blank. If you notice any new changes in the grid, you should contact your ophthalmologist promptly. Be sure to keep all scheduled appointments with your ophthalmologist. Also, if you notice any changes in your vision, you should call your ophthalmologist right away. Monitoring your vision is a vital step toward the goal of preserving your sight.